So our next speaker is from Spain. It's Cristina Andreu, and the title of her presentation is A Field Study about Incidence, Risk Factors and Consequences of Ketosis in Dairy Cattle.
Good morning, ladies and gentlemen. Today I'm pleased to present you a field study about ketosis, incidence, risk factors and consequences in dairy cattle. Can I have this one? Okay. Thank you, that's fine. As we all know, transition period is a difficult time for the cows, and many of those cows suffer from any kind of metabolic or infectious disease after parturition. We have seen this morning that negative energy balance is together with hypocalcemia and also with immune suppression around parturition, one of these main root cause underneath these postpartum diseases. Fortunately, we can measure the depth and the intensity of this negative energy balance quite easily by the concentration of blood beta-hydroxybutyrate during the first weeks after parturition. Then, the aims of this study were to determine the incidence of ketosis in different areas on production systems in Spain and to identify potential risk factors and consequences of this disease with special attention to milk production. 19 dairy herds located in the main 4 dairy areas in Spain were enrolled in this study for a period of 13 months, providing a total of 3,095 cows. Approximately 1/3 of those cows were primiparous cows and 2/3 were multiparous cows. All the cows enrolled in this study were tested for beta-hydroxybutyrase in blood for at least at 3 occasions, 2 weeks before parturition and in the first and third weeks after parturition. Those cows were classified as having clinical ketosis or subclinical ketosis according to the level of beta-hydroxybutyrate in blood. When they have above 3.0 millimole per liter, we say clinical ketosis. Between 1.2 and 3 millimole per liter, we said subclinical ketosis or ketosis in general whenever this blood BHB was above 1.2. On the day of sampling, these cows were recorded for their body condition score, and several parameters were collected at the day of calving. Also, the occurrence of postpartum diseases such as retained placenta, hypocalcemia, metritis or mastitis occurring in the first 3 weeks after parturition, and some information on the feeding fed before calving, a dry-off and close-up period, as well as daily individual milk production, date for artificial insemination, and date for pregnant services. And for these multiparous cows, we record also the day and the days in milk at dry-off and the level of milk production at the previous lactation. All these variables and factors were analyzed through logistic regression models to see the impact on the incidence of ketosis and the consequence of those ketoses. Overall, incidence of ketosis was 28.3%. You can see subclinical ketosis affect 22.6% of the cows, while clinical ketosis was in 5.7% of these cows. This incidence is quite similar to the one reported in other European, in other studies conducted in European herds, and it's slightly superior to the incidence reported in one of the studies that includes Spanish herds for 100 farms. And the difference may be because in this study, cows were sampled only once, while in our study, we sampled it 3 times. Interestingly, as it happens normally in this kind of studies, only 9.2% of these cows, it's a small proportion of these cows, show or were purported to show the clinical signs for ketosis. While clinical ketosis was quite constant through the 3 sampling periods, subclinical ketosis peaked in the first week after parturition, which is according to the previous studies, and we may expect a higher incidence of clinical and subclinical ketosis before parturition if we had used a lower threshold for beta-hydroxybutyrate for this prepartum period. Analyzing these logistic regressions for the risk potentially affecting the risk of ketosis, we find these classical factors that we all know, and it's reported in many of the studies as parity. We can find that multiparous cows have 2.34 times higher risk of developing ketosis than those primiparous cows. Also, the type of calving was affecting the risk of ketosis. Those cows calving twins have 2.25 times higher risk of developing ketosis than these cows calving a single calf. Also, risk of ketosis was higher for those cows that were in a higher body condition score before parturition. In fact, there was an additional twice the risk of suffering ketosis for each additional 0.25 points of body condition score. And for those cows losing body condition score from the first test before parturition to the third test after parturition. It was twice the risk for these cows for each 0.25 points of body condition score lost. Interestingly, milk production at previous lactation was a significant risk factor for multiparous cows. We find that cows with a higher milk yield in previous lactations were more likely to develop ketosis than those lower producer, their hair mates. If we compare or we classify the cows into 4 quartiles according to the previous lactation production, we can see that these cows in the lower quartile, those cows producing less than 10,800 kilos per milk, had an incidence around 31%, while the upper quartile, the higher quartile, suffer, those ones producing more than 14,000 kilos in the previous lactation, they reach a 40%, almost 40% of ketosis incidence in the next lactation. Season of calving also affects the incidence of ketosis, and we can see that in general, cows that calve in summer had a 40% higher risk of developing ketosis, but we see different patterns depending on the regional areas. In this map, we can see the different incidences of ketosis for the different regions. The highest one is this area here, which is the highest productive and the more intensive herds. And this is the evolution of the incidence of ketosis through the year for the different areas. As you can see, 3 of these 4 areas peak incidence in the summer. It was quite high, 37.5 incidence, while in only one of these regions, which actually is the hottest region in Spain, which is the south, there was not that high incidence of ketosis in summer, which was opposite to what we may expect. The reason for these different patterns may be related to milk production. As you can see in the other graph, you may see how milk production is quite more or less constant for the northwest and northeast regions that are the ones that are peaking in the summer, the ketosis, while milk production drops dramatically in the south region, which is the region in which they don't experience a higher incidence of ketosis in summer. These results suggest that actually this heat stress that may decrease dry matter intake for these prepartum cows may act differently depending on the management and of the animals in different areas, and can in some way decrease this milk production, or in other way increase this negative energy balance, and this increase also the ketosis incidence. Talking about the consequences of ketosis, and in contrast of what is published in previous studies, we have seen a higher milk production for ketotic cows during the first 100 days. This was significantly, but we need to take this result very carefully. One may wrongly think that ketosis increases milk production, instead of thinking something that is more probable, that is that ketosis is more likely to occur in cows that are higher producers, and which is also consistent with the results in the first part of this study. In fact, if we compare the milk cost for this ketotic and non-ketotic cow for the first 15 weeks of lactation, we will see a similar level of production in the first 5 weeks of lactation, and afterwards, ketotic cows produce significantly higher amount of milk. This, again, can suggest a potential milk loss in those cows that are higher potentially and those that are in a higher risk of developing ketosis. Finally, according to the previous studies, we show a detrimental effect, a detrimental performance in the reproduction of cows that had suffered ketosis, with a lower percentage of cows being pregnant at the end of the study, with a very low odds of becoming pregnant after 100 days after parturition, and with a longer interval until pregnancy for those ketotic cows than non-ketotic cows. As we have seen that these ketotic cows are cows that are higher producers, we need to correct this possible effect including milk production level in the model, and even though we have seen that odds of becoming pregnant still very, very low for those ketotic cows. In conclusion, overall incidence of ketosis in this study was 28.3%. Cows calving twins, those cows that were multiparous, cows calving in summer, and cows having a higher body condition score or losing body condition score, together with cows that have produced more milk in previous lactation, those cows have a higher risk of suffering ketosis, and cows suffering ketosis show a lower odds of becoming pregnant, longer interval until pregnancy, but have a higher milk production in the first 100 days of lactations, taking in consideration that this difference was after 5 weeks of lactation, and production was the same for the first 5 weeks of lactation. Thank you for your attention, and if we have the time, I will be happy to.
That was another excellent presentation, very, very clear and concise. So if anybody has a question, again, just put up your hand and we'll get a microphone to you. We certainly have time for 1 or 2 questions here as well. So just in the meantime, Cristina, I just one question there. You mentioned that body condition score at calving being one of the main risk factors. I was just wondering, would you elaborate on what was the risk, what range of body condition score at calving did you find as the risk for ketosis? What if you were putting a numerical score on the body condition? What body condition score at calving did you find to be the risk?
I would say above 3.5, there's a risk. But in this study, what we see is that, we have no very many cows that are in a lower condition score. So for those cows, for each increase, there was a higher risk. For me, maybe 3.5 is the correct one, or the optimum one, and after that, you will have every time a higher risk. But it's not the body condition score, but for me it was very important in this results that it's not only the body condition score before parturition, it's the loss of body condition score during this transition period, which is a reflect of this ketosis.
Excellent. If there's no further questions, then we'll give another round of applause, Cristina. Thank you.
Thank you.